I'm Dr. Marsha Sanity.
And I'm Dr. Caleb Moore.
And this is
the Free Smiles Podcast.
I'm Dr. Caleb Moore. I'm a dentist here in Colorado. And I've been practicing for about 1.5 years now.
Amazing. So my name is Dr. Marsha Sanity. I'm a board-certified general dentist. I have some additional trainings that we'll probably talk about at some point. And I've been working in this profession for 18 years, but I've been a dentist for 1.5 years as well.
What are some unique qualities that you bring to this profession?
So I think it kind of stems from just a genuine curiosity of life. So ever since I was even a kid or teenager, I always had just curiousness to find out why things are the way they are instead of just being accepting of things being as they are. I was a bit of a rebel, so I feel like I was always trying to question, my authority or question, why am I being told this or why is this happening? So I think when I started in the dental field, I already had a curiosity for humans, human interactions, development. A lot of that comes from just wanting to understand mental health when it comes to my family. And so I think I just had that curiosity of human beings, and somehow dentistry just kind of fit a lot of my interests. So I feel just that genuine curiosity, just wanting to learn more, find out why, has just led me in a journey of just constant education. I'm always wanting to be I want to learn more about that. I want to deep dive into that. So
how old were you when you had this realization, when you started your journey into dentistry?
So I officially started when I was in high school. So I want to say 2006, but I don't remember. So whenever I was 16, I think it was 2006, I was going into sophomore year of high school. That's when you picked a vocational program. So my high school had options to pick a vocational. It was very vocational based. So you either went into a nursing vocational, auto shop. Dental assisting was one of them. My sister did hair. My other sister did broadcasting, radio and TV. You didn't have to, but it was just kind of normal. It was a blue collar town. So I chose dental assisting for whatever reason. And then from then it just kind of grew. I never thought, I was I'm going to do this the rest of my life. I was just I want to find a job out of high school, because I knew maybe college, but then I was no one really went to, my dad didn't go to college, my mom didn't go to college. It wasn't a for sure thing that I thought I would do. It was just I need to find a job that's not working at the pizza shop I was working at as a teenager, or,
Right.
Yeah.
What was going on in life during that point?
What was going on?
We're thinking way back years ago.
Yeah. So at that point, I was living with my dad. So I grew up living primarily with my mom, and then we moved in with my father, my grandma, technically. So when we first moved there, it was just I went from going to a small little Catholic school to going to a big city, just outside of Cleveland, public school. And I think that time in my life was just very exploratory. It was kind of a little rogue. I felt there was less, I feel my whole life was a little rogue. My mom always worked 3 jobs. I had 4 siblings. We were just, crazy. So living with my dad, my 2 brothers were already away, for the most part at that point. So just me and my 3 sisters, and we were, getting into our teenage years of just getting in trouble. Not, our dad was retired at that time. He worked for Ford Motor Company. So he was retired, essentially living off his pension, which was not a lot. So we didn't have a lot of money. So most of the time we were I was either working. So I worked a lot. I worked 2 jobs in high school, just to, save for whatever it was in life that you needed to pay for.
Right.
My dad never had a lot of money. That's why I think I'm used to having the heat being at 50 degrees.
I spent 4 years with you.
Right. So we lived together for 4 years in dental school, which is how we met. So 4, 5, 6 years ago almost now, we started dental school.
Yeah.
I think we should talk about those moments.
When
we started dental school, I wasn't living in the house yet. So I was living with a friend of mine when I first moved back to Columbus to start school. You were living in the house, I think, right away.
Part-time. I was commuting from my blue-collar town.
Yeah, that's right.
And getting up at 4 a.m., going to the gym, trying to make that routine, and then just having a place to crash. We were at the fraternity. We were in it. So,
yeah.
But yeah, when I first met you, I was part-time, going back and forth.
That's right.
And then finally transitioned to living there full-time because
Yeah.
it just became too much.
I think we were both very similar. So neither of us lived in there are technically full-time when we first started school. And then in October of our first year of dental school, I moved into the house full-time. My husband and I were doing distance at that time. So he was still living in Colorado. He's from here. He started a business here. He had no way of leaving when we started. So I did distance. So me living in this big house with a bunch of random bros was his perspective of what are you doing? I was 29 at the time when I started dental school. So I was a little older. He was like, why are you doing this? And I was like, well, it's really cheap. And I think I was just missing that aspect of being around people in our class. Because even my friends that I knew back in Ohio that lived there, everyone's my age was having kids, having a family, they're older and they're kind of in a different part of their life where I felt like I was almost taking a step back in a sense when it came to my social life was on pause. I wasn't able to really see a lot of my friends or do things like that because we were so bogged down in that first year of dental school. So I moved into the house. That's where we met was when I first decided, Jeff Martini, one of our classmates, well, he was a couple years above us, he asked me, it was winter break, I think, that's when you first kind of moved back into the house, officially?
Yeah, I think it was December.
Yeah. So when that was happening, I had taken upon myself to just, clean things. So because I kind of have a history of that house. So when I was in hygiene school, back in 2012, I graduated hygiene school, but SIO was still there. It's been around for 100 years. So when I was in hygiene school at Ohio State, that's where we would hang out. We did so many events there. Right. It had big history for me. So kind of going into that house was a little nostalgic, but also it wasn't well taken care of. Over the decades of just different classes moving in there, different event, that place just got really run down. Right. So to me, it was almost like I was trying to rejuvenate some pride into that place because I feel when I moved into that house, everyone was kind of, in their own little world a little bit. There wasn't a lot of collaboration on a lot of things. Mm-hmm. So I think to me, just taking care of it, just without any wanting any recognition, just being hey, I think I'm going to clean out the kitchen in the back. Yeah. In which, I got attacked by a couple rats doing that, which was so fun. But doing that led Jeff to ask me to be the house manager with him. Mm-hmm. And then when he was leaving, then you became the house manager with me. Right. And I think that's when mine and your relationship just really, I don't know, it grew. It wasn't just, we were just classmates living in a house together. We were fixing toilets. We were fixing gutters. We were solving roof problems. We were dealing with, property line issues and trash and, all that on top of going to school and trying to create an environment that when we came home, it was a community, which I think we ended up accomplishing. I think so too. Yeah.
I wanna circle back though to something you said earlier and how it shaped you to become the person you were when I met you, because you were already this amazing. When we met, we connected on another level. It wasn't just classmates. It wasn't people who lived in the same fraternity. We connected on an emotional level. And I think we shared, I don't know if you want to call it trauma or, we shared a lot of values of hard work and determination to get where we were. Yeah. So you talked about how SIO was this place for you in hygiene school, but how did you even get to Ohio State? Because you talked about how you were working at a pizza shop and you were going to a vocational school and your dad was, working 3 jobs and your sisters were doing all of these things. How did you transition from that, your blue collar town, to going to Ohio State, which is arguably one of the most prestigious dental schools, right? And even for dental hygiene in itself, that's a huge accomplishment. So I want to focus more on your transition from that point of your life to how we met, right? So tell me more about that.
So I had to kind of dig deep for a second because I'm trying to, because like at this point in my life, I'm like 35. I'll be 35 in like 2 weeks. I feel like the person that you are at this time, you almost forget where that came from. And I kind of reflect on this a little bit, like with my husband, because he grew up in he grew up in the mountains. Right. A very hardworking, well-off family, like didn't really have to, he did work hard, but I reflect on this all the time because even little things that I do, like when it comes to like being really frugal with money or being very like frugal when it comes to like waste, I think that comes from just growing up poor. And I don't think everyone comes out of that situation in the same way, because you could look at each of my siblings and I would arguably say, yes, we're all strong people, like, and we're very strong, like hardworking, but all of us have different personalities. Like not everyone is like the same version of, that outcome.
What motivates you? What drives you? Your core values. It's different for everybody. Yeah. And whether you're in that financial state of we're struggling and we really have to make things work right now, however that may be, or even now looking at where we're at today, I think that your values have always been the same, and they've adapted to the situations in life that you were in, but who you were as a person, that stayed consistent. And that was one of the things that drew me to you, right? Because you can feel that. There's an energy to that. And I think that it drives us every day to be the people that we are, and the doctors that we are, and how we take care of people. But you were finishing up assisting school.
So I was 16 going into this. At that point, I was working two other jobs. So I was working 2 jobs in high school. Finishing high school, I finished my vocational program early, got board certified, I think my junior year of high school. And at that point, I mean, it just seems normal to me, like working through high school and working 2 jobs and applying I had no idea what it was like to go to college. No one was giving me advice. Like me taking even my like ACT or whatever you take, that class or test you take in, I don't even think I studied for that. Like, I don't even think I had any kind of, like, tutoring. Like, I think I just showed up and took I don't think I had a calculator, which is so, like, looking back, it's, like, the chaos of, like, but you just do things. You're like, I'm supposed to do this, so I'm just going to show up. And I was probably out the night before because, half my friends were menaces. And and that was just normal. And I think that, again, my, like, rebellious spirit of, I could have done way better on that exam. I'm sure I didn't do great, but it got me.
But you got into Ohio State.
I got enough to go to the next steps, and I think that showed me just getting into university. Like hard work doesn't stop when you get to whatever that destination is. That's when the hard work kind of begins. Yeah. And I think over time, I kind of learned what what making the right community is. So finding people that are not even like-minded, just have a core value of like hard work and just a drive to accomplish things, but also not like it's all about me type of mentality. I think I've always had a strong just drive to be more community focused, like community service and, offering help to people that, not even close to me, just trying to make the people around me better. Also reflected on like me becoming a stronger person or maybe a leader, because I ended up taking a lot of like leadership roles later in life and throughout that part. And I think just a genuine just curiosity of just wanting people to be better and want myself to be better without any strings attached. Like meeting you, like you shared those same things. Like you came in, you're like, yeah, I had to work really hard to get here. And I think I resonated with that a lot because a lot of our classmates, even if, they did work hard, like getting into those programs is not easy,
hard work for
no matter where you come from. But I think we both shared the core value of, yes, I had to work hard in school, but also I had to work hard just to survive in life to this point. Because we essentially both were raising ourselves in different ways. Like
there were many times where our backs were up against the wall, right? Yeah. And I think a lot of people in that environment in dental school, they didn't have that. Your back's up against the wall. It's like, where are we going to go from here? What things do I need to accomplish to survive or pay my bills or pay back my student loans or even just pay for classes in general during the time, or books or the resources.
Yeah.
And so I think that, yeah, like you're saying, it drives you, and it really puts things into perspective for us that we're so grateful. We're grateful to be where we are because of how we got here, right? And I think that that's not something that you have to speak on or say. It's just something that's known and that you can feel. And I felt that in you.
You also went to hygiene school, and you also got your bachelor's in that.
Yeah.
You came from, like a small town in Ohio. What kind of led you on your journey to even start dental anything, like to go to hygiene school? Like, why was that even a thing in your mind?
So it's funny because when I think back, somebody recently asked me a question, and they were like, what book or person or life event inspired you when you were younger? Like, what have you, I want to get to know you. I want to know what inspires you, what resources you had, if it's a book or if it's a person, to become who you are. And I was thinking back, I'm like, I didn't read when I was growing up. Like, I wasn't a reader, and I was always focused on work. I had a job when I was 14. I was washing trucks. And so reading and school.
Wait,
and
like big trucks?
Like
semi-trucks? Stop
yes.
it. Really?
Yeah.
How do you even clean a truck like that is my question.
There's a really tall ladder and a lot of water. Like, I would come home and my feet would be soaked. It's kind of gross, but like, I would have to dry out my shoes. I had 3 pairs of shoes that I would cycle through to do this job.
Oh my gosh.
And I couldn't drive at the time. So there was one of the guys at the trucking company lived close to us, and I would hitch a ride to work with him sometimes. And so
perfect. Anyway. Little Caleb, 14, hitchhiking to work.
Yeah.
Awesome.
Well, he's a family friend, I guess. But everyone knew everybody where I grew up.
Yeah.
Bell Valley, Ohio, that's where I grew up. There's like a population of less than 200. Not even one stoplight in that town. So I think for me, being a dentist or thinking about what I wanted to do with my career, it stemmed from this vision that I had for myself, this life that I could see and picture. And it's not, the white picket fence or the family or the cars or the money. It wasn't that. It was the people around me, even just my classmates who were maybe, they were better off in terms of finances, and they were playing sports and they were really good at that. And I was like, I want to do that. So I think it really stemmed from me, 4th or 5th grade. I'm like, I'm going to join the basketball team. The people in my class who seemed to be doing better, in terms of the quality of life they had. They were just happy every day. They didn't have worries or stress. They were just carefree, and they came to school and they had a sense of community. I'm like, I want to join the basketball team. So I joined that, and I created a community for myself. And I surrounded myself with classmates whose families were, more well off, or they were teachers, or some of them were doctors. And for me, I think it gave me a glimpse of what that life could be like and what I could provide for my kids in the future. Whether or not I'm going to have kids now, that's up in the air, So life was very different back then.
Yeah, but the goals, I think the things that you're saying are, you resonated with something in these people. You said, I aspire to be this way. I aspire to, even if it's like, oh, I like the way that this person carries themselves. They look like they're, confident. They look this way. I think as young adults, like myself as well, like when I was 14, same thing. I had a part-time job. I think it was illegal, actually, that I was working that young. But whoever was that gave me that first job, you look at those people that are adults around you. And I grew up, and you might have too, with I had older siblings.
Yeah.
And just being surrounded by older people, I think I had a lot of influence from people that were older than me. And you get to learn by their triumphs and mistakes. Like, hey, you see when they accomplish things, but you also see how people fail, especially in a small town or in like a city area where I saw a lot of drugs. I saw a lot of people getting, DUIs, messing their lives up. Just reflecting on that as someone who was too young to do those things. You also reflect on, okay, well, I see this as like I could have gone down that path. I could have gone down the path of any of those other things, but for some reason you didn't.
And I think, yeah, and you don't, because you see the path and you know what you want for your life. It's not that you're reaching this goal or this point, like I want to make X amount of money or I want this. It's I don't want to deal with this.
Yep.
I don't want, I saw my mom struggle for years she was working full time, raising 3 kids on her own. And I saw how it affected my life too. Having that, like we talked about, the perspective or core values in life, we had to learn at a young age what was good in life and what was bad, and what we should expect and what we shouldn't expect. And when you're that young and you're seeing people in your life struggle or working these jobs or long hours, and realizing that, for me it was, I'd be at a basketball game, for example, and have to worry about if I was able to afford the shoes that everyone on the team had, the nice ones, or having money to even just, everyone would buy like the purple Powerades that were always my favorite, but having cash like on me to get those things before the game, like while JV is playing, before varsity, and just little things like that. And even the emotional side of it, like their parents being there every time and cheering them on. But my mom is working a 12-hour shift, so she made it to a lot of my games and really made that work. But there were a lot of things in life that I realized that not that I was missing, but that was different from the people around me. Mm-hmm. And I wanted to ensure that when I grow up, and if I have kids, or just in general, that I knew there was something more, and there was more out there for me. And how was I going to get there? So, working, in high school, I played basketball, I ran track, I was going to college. I actually graduated high school with almost my associates. I had 2 years of college under my belt. I was traveling for that. I was traveling for games, and for college, it was 45 minutes away. I was paying for the gas. I was working a part-time job, doing all of these things. And, really what was motivating me was I don't want to do this forever. Like, I don't want to be constantly, I'd see my mom come home from work and she's just exhausted. I don't want that. I want to have a balance in life. I want to be able to work and do something for the community that I'm in and for the people that I love, and then be able to also fulfill my life at home. And, a lot of the people around me when I was in middle school and high school, they would go home and have dinner with their families and maybe play a game, or they had an Xbox, and I never had one of those, and which is probably for the best because I'm not a video game person now, right? But I wanted to be able to focus on those. But when I went home, it was, what are we making for dinner? Because mom's not going to be home until 8 p.m. What are we going to have for dinner tonight? And really just, okay, we got to do the laundry and do the chores, and everyone had those things. But for us, it was just different. And that. I mean, you went through the same thing. So
I agree. And I think without knowing that, we didn't know this about each other when we first met. We knew that we had some kind of connection, and it wasn't because we had these long. I don't think I've ever knew most of the stuff about you till this moment. I mean, I knew, obviously we've known each other for a long minute now, but the first year that we knew each other, it wasn't like we were talking every weekend about, oh, when I grew up, I did this.
I went through this, and I went through this. And
when we knew each other, it was just, hey, we have a problem, let's solve it, because this is what we know how to do. We know how to go through and see something and not be torn down by an adverse situation.
Yeah.
We just know how to power through and find a solution, which isn't a teachable skill.
It's not.
Going through, and I didn't realize that, and this came from just knowing that no one else is going to solve my problems. If I can't, even when I was in dental assisting in high school, I paid for all my scrubs, I paid for my class, I paid for my board exams, I paid for whatever. I didn't have a car, I got rides with friends of mine, who were, thankfully I had really awesome girlfriends,
oh my gosh,
growing up, and people that, which I think also goes to the character of you as a person. If you grew up and you needed to do XYZ to get somewhere, you were able to find someone who believed in helping you.
Yeah.
So I think that goes to show your core value reflects on you're not in it alone, but you're able to find people that also are hey, you're my friend, you're my whatever, I'm going to help you with getting to work when you're 14 or whatever it is.
No, I 100% agree with that. And my mind goes back to one of my friends who he actually lived pretty close to me, and William was his name, but he, and looking back, like at the time, you know, because when you grow up in a small town, there are social hierarchies, and you know, you may not fit in with these people or those people, and for me, I was always a little different, you know, and so at the time, I may not have been, not that I wasn't grateful for it, but didn't recognize who those people were in my life. Those people who, like, we recognize what you're going through, and we want to step up and be there for you. And him and his family were one of those people for me. I mean, his mom, I still think checks in on my mom and how we're doing. But at the time, like, he was giving me rides to practice every day. My mom was at work, and you know, whether my grandma or aunts could do it, that was, you know, just a different struggle, you know, trying to, you know, rely on these people to help you reach your goals, right? And at the time, it was something bigger than I even imagined. I didn't, you know, you always think, I'm going to do something great, but I didn't realize, you know, that I would become a doctor, and I'd be the first one in my family to ever graduate college. But going back to that point, you know, hitching rides to basketball practice and relying on this community that I had, I really, I don't know, I'm really grateful for it, but it was a lot of work and a lot of struggle. And when I was in that moment, my sisters were actually, they were fortunate enough, my mom, you know, financed it, however, to get them braces at the time when I was in high school. And going through all of this, and I would have to go with my sisters to their, you know, their ortho appointments and check in, and they had teeth that were missing, and it was, you know, just really, really intriguing to me. And so I thought, this is what I'm going to do. Like, the dental field, my dentist is always so happy, you know, he's, you know, well off, and the office is really nice, and, you know, he's volunteering and, you know, sponsoring, and so I wanted to be that person for my community. And I thought, you know, the surgical aspect of pulling the teeth down and moving the teeth into place and all of that, I think that's what motivated me, but I didn't know how I was going to get there. So finishing up dental school, I had 10 years of experience in dentistry at that point, and, you know, graduating hygiene school and then graduating dental school, graduating both of those with honors, and really holding myself to this high standard throughout the career. What do you do next? And how do you achieve those things at such a high level now that you're the newbie again, right? So now you're not graduating dental school, you are a new dentist, and you have to step into the field and really just learn all of these skills, even if we've had the experience in assisting and hygiene, and it's different when you're sitting in that chair and you're the one taking care of people. So I had this goal to be the best always, and graduating with honors, I took an associate job right out of school knowing that I wanted to be a part of a group and to have mentorship and to learn as much as I could.
When you first left and you first joined that first associateship, it wasn't your dream job.
Oh no.
It might have seemed like it was a great, you know, at the time you're like, hey, this seems like a good opportunity. But then in reality, when you're like kind of going through that, it's not always how it is. You're like, hey, I actually really don't like the way they run this part of the company.
Right.
The support we're getting on this isn't great, or whatever that may be. Or maybe the associate that you work with or the team that you thought was great really isn't there.
Yeah.
And I think that reflects on the stress of first starting off in the field.
Oh yeah. And when I was leaving dental school, you know, our last semester, you really don't have a clue of what you're getting yourself into. You get this contract and everything seems okay on paper. You're a little bit nervous about it, but you know, you speak to the owner and the office sounds great, and you're just eager. You're eager to get out there and to get started. And for me, that wasn't what I was walking into, and I had no idea. So I think, you know, in another episode we should dive more into how to, you know, what red flags to look out for. Mm-hmm. But I was eager. I didn't take time off after dental school. I took 2 weeks, I think, mm-hmm. and then I started my role, and I was an associate in Columbus, Ohio, actually. And so I was staying in Ohio, and which I never envisioned myself doing. You know, after 4 years of dental school, I thought I would move away immediately. I ended up staying and taking this position, and had a lot of inconsistency with, my assistants. They were struggling to keep an assistant on, and the front desk was fired, and the lead assistant quit 2 weeks before I started. So I was walking into this mess. I had no idea. I was told that it was stable and had been running for years, and the doctor was out because he was sick. And so, yeah,
I remember this now. Yeah.
So, anyway, there was a lot of misconceptions for me, and and some of that is on me, right? Like coming out of school, maybe thinking, well, because I have 10 years of experience, I can leverage this and use this, but there's only so much you can do. Mm-hmm. I can't run the front desk and work without an assistant and manage, doing your hygiene exams while trying to complete a root canal and right out of dental school. It was a lot. And for me, it wasn't that I wasn't up for the challenge. I just knew it wasn't what I wanted. And I wasn't going to grow in that environment. I was basically trying to survive each day. Mm-hmm. And so I realized pretty quickly that first job wasn't for me. And what I was really looking for was stability and support, and to have a community of other doctors like you, for example, to bounce ideas off of and to learn and grow together. I mean, you and I alone, we've taken hundreds of hours of CE in our first year out together. Yeah. And to do that, you have to have stability in the practice that you're working in. I think that's really important walking out of dental school. Have stability in the clinical side of things and the administrative, that side of things too. Everything has to be lined up so we can focus on taking care of people and growing our skills. And I think for us, we had a unique perspective because we had, you had 15 years of experience or whatever it may have been, and I had 10 years. And so we had a lot of background, and we were able to put those things. Those weren't high on our priority to be able to drill efficiently and to do these hygiene checks. And we had all of that down. So I think for us, it gave us a unique ability to be able to focus on growing as doctors, right? And we fast track that. We have reached a level of success that some doctors, maybe 10 years out of school, still don't have, in my opinion. Mm-hmm. So I think that speaks a lot for who we are, and really just focusing on growing. That's what that first year out of school is for, and connecting with people and investing in CE. So, I think that, and you can dive a little more into that, but I think our qualifications that we have, even though you leave dental school and you're the new dentist and you feel like you're bottom of the totem pole again, I think always climbing to learn and reach that next goal and to invest in your skill set, it's gonna lead to success, and everyone's on their own timeline on that. So, which I think is,
to kind of reflect on that in my own perspective, yes, I had been through training in the dental field since probably 2006. I earned many board certifications. I had a BS in hygiene. I'd been practicing for 10 years by the time I graduated dental school. I think the one thing during dental school that helped me to kind of stay relevant in the field and just to not to be bogged down of how almost some of the education in dental school is a little bit outdated.
Very outdated.
I think I'm being kind when I say that. Is that, working weekends at a whatever dental clinic is open on a Saturday or a Sunday, and not that that's probably the best practice that I wanted to be part of, but even just still working with people outside of dental school as a hygienist, and then knowing that the mentors that I had made along that way were not even that they would be part of the new office I was going to join, right, but I think just earning mentorship with people as you're going through dental school, the amount of classmates that I had talked to that were like, oh my gosh, you're still working, I don't know how you're doing that, or hey, what would you suggest that I would do, because I want to start getting some experience before I graduate.
Yeah.
And I was like, oh, well, you already went through 2 years of dental school, you're in your third or fourth year, you can apply, at least in Ohio, you can apply to be an EFTA. You can take the EFTA board, you literally take it on a weekend, you can start going out and doing restorative work under supervision of a board certified dentist and get experience doing that. But no one did that.
Nobody did.
Everyone was like, oh, give me ideas of how, blah, blah. And then they wouldn't do that. They would do some, which is I think that's a personal choice, and I think that's fine. But if you truly want to be better, we don't have the money coming out of school to take all these CEs right away. But you do know your local OMFS that you refer to, and you can ask them, hey, do you mind if I come in one day every couple of weeks just to see how your day goes?
Right.
Like, when I first graduated, I spent at least one day a week going to a different doctor that I knew as practice, learning how they did things, talked about treatment plans, talking about techniques of things. And a lot of these were more like advanced procedures. Not that I'd be doing a full arch smile design my first week graduating, but I knew that's where I wanted to be. And knowing the steps that are just the basic things of like, what do you use for buildups? How do you go about scanning? Because we don't know anything about scanning when it comes to really leaving dental school in general, but also the technology that can help you be successful. So just learning those things, and it's just time. Because at that point, you don't have money. You don't have a lot of things like to invest in a lot of CE. I mean, maybe you do, but I didn't. Like, I love being like, I got debts. I gotta move back. Like, there's a lot of going. My husband's a small business owner. It's not like we had a lot of financial like support going into my career. So it was me just spending time and just talking with the mentors that I had met over the past, at that point, probably 15 or 16 years. And I think that's what kind of motivated me to be like, hey, I'm going to just take every opportunity that I'm, foreseeing or opportunity that I'm given to just do CE. Because even with my company that I ended up joining, like there was a lot of free opportunities for CE, but a lot of the doctors weren't going to them. Like I was one of 3, I think, that went to these out of a company of, 60 dentists. So maybe they had known, been practicing for longer. They don't need to be, going to these classes. But for me, even like a review class, I still learned one thing that I didn't know before.
Techniques are always changing.
Techniques are changing, or someone's perspective is changing.
Yes.
Like knowing like, oh, when you do this extraction bone graft and immediate implant placement, you're doing this technique, which can help in this situation. I think it's just the more tools you have in your toolbox to work through, because no person's the same. I think just in the medical field, it's very naive to think, oh, every time I'm going to do this, this, and this. That's never it.
No. This field is so dynamic.
Yeah, there's steps that are like quality of care that you need to follow, but there's also like you need to pivot, like you need to know what the problems are going to be, and that comes from experience. But we didn't have experience, so I would be learning that experience from someone who's been doing this for 30 years and talk about their experiences and how they dealt with problems, so that I can deal with those problems with their foresight in mind. So I think that's where even not having official CE or having the money to take those things at first came from just networking, knowing the right mentors. I would even walk through cases with classmates of mine on Zoom. Because they were like, hey, what do you think about this? We're both in the same, starting point, but hey, it's a different perspective. Or one of our housemates would call me and be like, hey, I have this oral path thing. What do you think about this? And I, obviously we're going to refer, but just getting the ideas of what's your thought process, or talking about, this perio issue, because I've been working out as a hygienist for 10 years. They would be like, hey, how would you, because I think the perio education was actually pretty decent through Ohio State, but you don't get like the physical hands-on part of perio. I think all dental students are missing because they have X amount of root planings that they do, and they're not doing anymore. They're not going above and beyond on that requirement. So I think also respecting your hygienist after you do these things is important.
But leaning on the people that are around you. Right, and reaching out to those who can help you. I mean, having, like you said, experience. It's not even your own experience, it's the repetition. It's going in on your day off. It's spending those extra hours to see more, because every case can be different, and the outcomes and the way that you plan it and the way that you're hoping things will go, but how they actually went, and seeing all of those things, the sooner that you do that, the more that you can implement that in your practice and what you're doing. And so I think that has been really beneficial for both of us coming out of school, because we have these other doctors that we are working with, And there's a big community and network in Denver, especially. And we have all of these resources at our fingertips, but everybody does.
Mm-hmm.
But not everybody's using it.
For sure.
And they're not implementing the things that they're learning. So it's using those core values that we had growing up, the drive to always be better, to work hard, your back's up against the wall and you have to keep moving. How do you take those principles and apply it to a new situation when we're stable, when we're doctors and we have this stability in life now, but using those things that fueled us as we grew up now to be better in the field that we're in, right? It's, no, I still need to, after work, take my online voice class, or go to another practice this evening to review a case, or on my day off, instead of focusing on the gym or whatever it may be, I'm going to go into the office and really just work hard and get that experience.
Oh yeah, and I mean, burnout is very much real.
Oh yeah.
I think the one thing that I learned, because, when I left school, I was pretty much, I joined a big group that I had known before when I was a hygienist. They had just started branching out when I worked with them, but by the time I, 5 years later, was coming back and, becoming a DDS with this group, I chose to be at an office that, was a purchased office. It really needed a lot of TLC, it needed a lot of leadership. I chose to take that on coming out of school. I was kind of maybe naive in the sense of thinking that I could do everything.
But you did. I want to clarify that you were doing everything.
Well, yeah, in a way, obviously you build a team. You build a team, and I think building that team is exhausting. We went from we had one person in the front, one office manager, my associate that I worked with, maybe one assistant, and one hygienist. And then within that first year, we grew to 4 hygienists, 4 assistants, 3 people up front, including the office manager, myself, and the associate. We went from 4 to 13 people. And training that's not like we're getting a lot of support for training on assistants or any of those things. It all came from us as doctors, and not all doctors want to train. Not all doctors want to take the time to educate and to spend extra time. I would spend just my free time sometimes just making a PowerPoint for my hygienist to go through different treatment planning things, or to make a PowerPoint about perio, and it's 30 minutes. It's just them sitting on their lunch. It's a volunteer time. I'm not forcing them to come hang out with me.
You cared about your team.
But I cared because a lot of the hygienists that we were working with, some had experience, some were just getting out of school, and I think they almost trusted me as a leader to be someone who was supporting them. I'm not going through the motions being hey, I expect you to do these things, but not giving you the support that you need to do those things. I'm backing you up. I'm saying, yes, if you're going in there and you're seeing these things happening, I'm not going to undermine you when I walk in that room. I'm going to support you, and I'm going to give you maybe a different perspective for that patient, so maybe your verbiage next time can be more, just to that person's personality or whatever that may be. And I think just coming into an office and assuming that you are a leader, I think is sometimes a fault. We are seen as leaders because we are the doctors of practices, but I think being a leader and being seen as a leader are very different things. I think we were able to grow that office because I would go in on the weekends and fix the shelves that broke. I would, paint whatever. I would, hang up things that, anything that needed to be done, I was doing it on my own time without thought. I was just hey, I want this to be more organized or be this way because it would make my team's day feel better. So I'm just going to go do that because they're running around all day trying to make the schedule work or whatever it may be. So to me, I think that's when I became probably a little bit more overextended, because then you're also doing dentistry all day long, being the leader of a practice, going in on weekends, seeing emergencies sometimes on the weekends when patients would call.
I went in one time and we did a root canal together.
Oh, that's right. Oh my gosh, we did. It
was on the weekend, yeah.
Because I was up, or it was on a Friday that I was off, because I was up helping you with something that you were scanning with that new scanner. And then I got a call about, I don't even know if it was a patient
I was starting a smile design. I believe I was starting a smile design, and I wanted you there to critique my scanning or to just help with the consult and the scanning and the photos. And so you were there assisting me with that, but then you get this call that your patient was in pain and really needed to see somebody.
Yeah.
So I remember.
And really a patient that I had never met. It's not like it was a patient that, but it was a patient that I'd been seeing in our office maybe a couple of years ago. But I was like, sure, I'll come down. Anyway,
So extra hours.
So extra things, which, gains you kind of respect in your community in a way, but I wouldn't recommend for that to be like a thing. Like, I wouldn't be like, hey, as a doctor, you should be going in on your weekends to do root canals, or you should.
There's a balance. There are periods of time that you have to spend grinding. You have to be doing these things. But I think, like you said, burnout is very real, and so it's unrealistic for us to say, yes, and, right out of school, you need to go in offices on your day off, and you need to be doing all of this CE and reaching out to people and X, Y, and Z, but the reality of it is we need time to relax, and you need time to step away and let your mind just be, right? And focus on personal, focus on your personal life. Being a wife, right? And spending time with your loved ones. So I think that's important as well. So you talked about how, you came into this practice and the office grew. Bringing in another doctor, the team has to grow, and so you were using the team that you had, and you were trying to, in a sense, build a new team, right? Make it bigger, better, support them, help them grow. How do you think that related to the work that you were doing? What your hard work training your team? How did that then? What were the fruits of your labor, right? What was coming from that? What cases were you seeing? How did that change the way you were practicing?
Oh, yeah. I think just taking all those years of experience that I had as far as like creating, just rapport with patients, how to just be a human as a practitioner, and to almost like train, because a lot of people you come into this field and you're like very stiff. Like you're like, I'm the doctor, I'm telling you the facts. And people don't want to hear, like, you know what I mean? Like, and that they're not going to take what you're saying as facts, being like, oh, whatever. But people care about how you make them feel more so than what you're doing. And I think just from being in this field for so long, like, I knew that going in and teaching that. Maybe my other associate, I wasn't necessarily trying to teach him that because, people are who they are. But I think my new team coming in, I really had to set the precedent of, this is how we talk to people. This is how we make them comfortable. And it doesn't take a lot. You don't need a lot of money at a practice. You don't need, there's nothing that monetarily goes into that. It's just how you say hi to someone, how you introduce yourself, how you sit them down, you ask about how their day is first, or even not even asking about their day. Tell them, what was, your favorite part of the summer? What do you have to look forward to coming up in the fall? Like, just kind of starting about something that's exciting. Yeah. Oh my gosh, you got a new puppy. Oh my gosh, show me photos. Yeah. Even if I don't, I do care about the puppy photos, but is it going to change my diagnosis? No, but it's going to make that person kind of relax a little bit, because it's very unsettling even when I go to my doctor, sitting on that table, like, I'm not comfortable. No. But I feel like just leading by example. I had more orthodontic cases that I started, more smile design cases than the associate that had been there for 3 to 4 years. Yeah. And I was doing cases that no one in my organization was doing their first year out of school. Right. And that's because I would go to my mentor and see how he would do this case, which was different but similar, or call them or be like, hey, do you mind if I get on a phone call with you? Or, hey, I'm going to send you, this person's whatever. Do you mind reviewing this? And I think that's what, just knowing that you don't know everything, which you sometimes leave a profession like dental school and say like, oh, I know so much. Right. I left dental school thinking I didn't know anything.
I agree.
Because you don't. You know how to prep. You know how to... But do you? Like, do you actually know how to prep for every single situation? Mm-hmm. Do you know what minimally invasive veneer prep looks like or a no prep veneer looks like versus, doing a full coverage or what those material signs, like no one knows that.
Right.
Because they teach you in dental school how to prep a gold crown,
Right.
which I've done, and those are relatable to other things, but they're teaching you so many archaic techniques that aren't applicable really when it comes to modern dentistry. So I think just taking on mentorship and just taking just a humility approach to it, my team really took to my perspective, because I would say thank you after every time I did a filling with them, or I would say, good job on this or that, or thank you for just little things about just your everyday life. You don't have to do those things. It's like holding a door for someone. Like no one has to do that, but it's just second nature to do it for me. Like it's second nature for me to be like, hey, I'm going to leave you as an assistant who I trained to do a temporary crown, but know that you can come get me if something's not going well for you, or if you're having a challenge in this. And I think just having that open communication with my hygiene team, my front office, whatever that may be, like they would come to me all the time. So I eventually had to go through like, hey, I can't have all day with solving problems. You guys need to, at some point, have your own autonomy in those situations. And I think that also relates to taking the time, but also not burning yourself out, and then finding that balance of, hey, I trust you to make this decision. And if you can't make that decision, then maybe we need to take a step back, but now you're autonomous. And then as I was leaving, because I left that practice, my team could do most of the things that I trained them to do without even asking. Like I would have a deprogrammer scan or an ortho scan or whatever that thing may be that I knew that they could do. Like, and I would have no question about the outcome of those things. So, and that's within a year.
You gave them you empowered them to do these things on their own. You put systems in place and set expectations not of what's right and wrong, but how to do this efficiently and effectively for the patient, and then gave them the tools and the power to do it, right? And then you were there for support if they needed it. So I think that's important to highlight, that you created a healthy balance. You took a lot of time in the beginning to cultivate that environment for them. And not only for clinical skills, but like you said, just to communicate and talk with people, and for case acceptance, and to just relate as human beings. And I think that gave you a lot of success. And also created a culture for you at work that you as leaders, we don't have all the answers all the time. We need to rely on our team to make decisions with us, right, together. And at the end of the day, if that decision was right or wrong, we can come back to that and we can grow together as a team to figure that out. But in the beginning, we have to be those people to influence and to guide and to give them the tools and create a team that you just foster an environment that is focused on growing and, relationships, right? Relationships with each other as a team, and with our patients as well. And I think that's why you've had a lot of success, and I've had a lot of success right out of school with these cases that we're doing, clear aligner therapy and smile designs. And so, when you and I were sitting down together and we're brainstorming, how do we share what we know? We have all of this knowledge from not just from ourselves, but from the years of experience we've had, the assistants we work with, and the other doctors that we work with. And how do we share this with people and give them the resources they need to do this themselves? I think it's a very scary thing to come out of dental school and to feel isolated. You're in a group of 400 other students all learning and trying to do the same thing, and you have all of these resources at your fingertips. But then we leave and we go out to our practices, and then you have to find these resources. So I think this podcast will be great for people to really just learn what we're doing, and also be able to have a space to think differently and think critically about how they're giving care to patients, right? Holistically, and look at the mouth as a whole and how it's connected to the body, and how does it function and look, and how do we achieve the patient's goals. I think one of the major things that you touched base on earlier that dentists are lacking when they come out of school is how to talk to people in general. If you can't communicate the needs of the for the patient in a way that they understand or a way that they value, they're not gonna move forward with the treatment, and they're not gonna understand it. So I think communication is one of the most important things that we do as providers, and having those skills to do that is going to create success very quickly for you in your practice. So that's the goal of the podcast, is really just to sit down, you and I, and bounce ideas back and forth and share what we know with people, right? So
I think it's very normal for a lot of us, just like every day we go through our emotions. I mean, yes, I'm talking to like the other doctors that I work with, I'm talking to the surgeon that I work with, but also just, in dental school we sat down, we would talk about cases together, or, we still do this, but I feel like it gets harder and harder as, life goes on. So just literally taking time to spend just going over certain ideas, or be like, hey, I really had this like idea this week about this, and being like, oh, I wonder if someone else has this thought, or I wonder if someone else found this really challenging, because there's so many ways to solve problems, and not all of them have the same outcome, but there's also really amazing ways to do things differently. And I think offering a platform for people to ask us questions, be like, hey, or ideas, be like, hey, I was thinking about this the other day, what do you guys think about this? And I think just having that just back and forth between our community as dentists, but also our community that we live and work in. So the general public, I think, could benefit just from not getting into the weeds of like how things are done, but I think a general understanding of a field that is so unknown to so many people. Like, just patients ask me that, just like, which I think are just great questions about just basic things about like, oh, how do you do a crown? Just because they're like, I know I understand what it is, I understand why you need it, but like, hey, like some people are just curious to why we do things certain ways. And I think as a nerd myself, like I'll listen to weird podcasts about neuroscience and behavior and space and, like random things. And I think there is an interest of that. And even someone that's just wanting to maybe get into the healthcare field and just kind of knowing what that is really like. Because when you go through school and you're looking at these programs and you go through a program, on the other side, it's so different than what you think it's going to be. And I think having that vulnerability to talk about maybe just not even the success, but the failures that we have seen and things that we would have done differently, I think is so valuable, as learning from someone else's kind of experience.
Yeah. And I think this podcast allows us to show people the human side of being a dentist and what dentistry is. There are a lot of decisions that we have to make every day, and choices that we make as providers that come from being a human, right? And I think this breaks things down a little easier for people to understand the choices that we make, the resources that we use, and how are we able to have success in this field while being a human and connecting with people and bringing that element to the field. I think that's what we'll do here, and I'm really excited for that.
I think we just want to talk about things that kind of come to us. I mean, that can come from like, hey, I have this case, or hey, I had this patient that had this issue that came in, or hey, I have all this debt, how do I make a financial plan? Because you're thrown, I think during dental school you have like, there's 20 financial advising companies that want you to sign up for their product when you graduate. There's 20 different loops companies that come in and say, we have the best product. Which, not that it's not valid, they probably have a great product, but how do you sort through what that means for you as a person, what's actually important for you? And I think there's no greater answer than just talking about those things. And really just understanding that the more knowledge you have on something and the more you talk about it, the better you are to probably make a decision on that.
Yeah. And I think for me too, one of the main goals that people have in dental school is financial freedom, right? And you come out of school with this large amount of debt, and you're like, how do I take care of this? And how do I be successful to be able to pay off my student loans and to have a good work-life balance? And I think that comes with connecting with people and connecting with patients and communicating with them and understanding why they need treatment. We're not here to just focus on one tooth. Let's fix everything for you. Let's let's figure out what your goals are and then come up with a plan that you're comfortable with to reach that goal. And so that's one thing that I really want to share with people on this podcast is that's how we are successful in our field. We are taking care of people. We're taking care of the patient first, communicating what their needs are, and then using resources that we're going to share here on this podcast to reach those goals. And I think creating those lifelong bonds with patients is what's going to bring you happiness and success and financial freedom. And it's not all about that, right? There are other aspects of the career that we want to share and give people insight to, but I think just having that as a basis for me and then focusing more on, clinical outcomes and the holistic side of things, and even just focusing on how you take breaks and what does burnout look like and how do we prevent that. There are so many resources that we can provide people here. I'm really excited to do that with you. Well, Dr. Marsha, this has been lovely spending Sunday mornings with you.
I love spending Sunday mornings with you.
Let's do this every week.
I think we should do this every week.
No, but it's really been amazing to get to know you more and your journey into dentistry, and I'm excited to sit down and do this.
I think we should just say thank you to everyone who's tuned in, and just to be excited about our future content. I think we're going to try to do this once a week.
Yeah.
Is the goal. Bring in questions and comments. Please subscribe to everything. And we just look forward to really learning together and just growing in our experiences.
So I'm going to see you back next week. Next week we are focusing on some of the misconceptions in dentistry and what that looks like for us and how we handle them. So,
yeah.
All right.
It's going to be good.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.